I'd like to invite Governor Stephen Lewis of the Gila River Indian Community to share his remarks. And if he has time, and if there is time, we have one or two questions for Governor Lewis as well. So I will turn it over to you, Governor Lewis.
Maria, thank you. And thank you to all the speakers prior. Thank you to the Blue Cross and Blue Shield for making this happen. Skugtas, Shamai Masma, everyone. How's everyone doing? My name is Stephen Rowe Lewis, Anyan Anapchugat, Stephen Rowe Lewis of the Gila River Indian Community, the governor. I'm proud to be the governor of the community. We are 531.2 square mile reservation. We're located along the southern boundary of the Phoenix metropolitan area, our current reservation. The community is made up of nearly approximately 23,000 community members, and 15,000 of our members are located on the reservation. The community also operates a 10-facility healthcare system that we run independently of the IHS. And I want to thank Rear Admiral Wiaki, IHS. You know, the federal government has a trust responsibility, because we're sovereign nations, for providing healthcare. And that's because of the long history between the US government and tribal nations. You know, our relationship, as we all know, predates the Constitution, predates the founding of this United States. So when we look at this unique relationship between the federal government and tribal nations, it's not just special and unique. As a tribal leader, elected by my people to lead, this is a sacred responsibility. And again, I want to thank Rear Admiral Wiaki for being a very respectful partner with tribal nations. It hasn't been always that way in the past. And as we look toward the future, as we look toward a new relationship with the federal government, with the incoming administration, I share the sentiments of many of my tribal leaders across Arizona, across Indian country, that we will have a very protective relationship, respectful relationship moving forward. Now, given all of this, the community's location, the size of our membership, the large land base, the hospital facilities that we run independently of IHS, that we run ourselves as a self-governed, self-determined nation, we knew immediately that we needed to have a multifaceted approach to the COVID pandemic. Now, unfortunately, in Indian country, we are not unfamiliar with the impacts a pandemic can have on our community. You know, in the earliest days of this country, as I said, we're very harsh on our tribal populations. And those stories, those collective stories, and those lessons remain with us today. So in February, in the earliest days of the pandemic, the Gila River Indian community, the people, the leadership, all of the stakeholders, we pulled together. We pulled together and I convened a COVID-19 task force. In fact, it wasn't even in February, it was in January when I actually brought this task force together, comprised of critical departments that we knew we needed to address the coming health and economic crisis. We included departments such as, again, our Gila River healthcare systems, our tribal health department, the emergency services departments, including our first responders, our police, our fire, our community enterprises, our tribal education department, and of course, our community council, our 17-member community council. We also made sure to include an elder representative and a youth representative to make sure we could facilitate communications to those two important groups in the community. The COVID-19 task force met consistently. every day in the beginning, to where now we are meeting at least 3 times a week. The meetings are these are through the incident command structure. These are daily briefings to keep everyone communicated with on the same page. Because as we know, this pandemic changes fast, rapidly, and we have to change. We have to be ahead of the curve. That's always been a challenge. Things change monthly, weekly, daily, sometimes hourly. So these meetings are a way to assess the prevalence of COVID in our community, as well as our ongoing, changing, evolving response to this healthcare emergency. You know, this allows us to make adjustments in real time based on the program that we diligently put together. Testing, looking at the enforcement data, testing, tracing, and treating. So the formation of the task force was especially important as it became clear early on that there would be an absence of any real, useful, actionable national plan and approach to COVID-19. As tribal governments, as sovereign nations, again, I cannot stress more than I'm already doing. Our government to government relationship is not with the states, is not with local municipalities, is with the federal government. So when the response to the pandemic was left to the states, we knew that as a government, we had to begin to advocate for, we had to begin to act as a sovereign nation, as we are inherently. We had to really get out in front of this. We had to formulate our own plans. This led to a series on my end, pursuant to my tribal constitution, a series of executive orders early on that I issued in my capacity as governor. Now, the executive orders, I want to talk about those, because those were critical tools that kept a massive outbreak of COVID occurring in our community, that kept our community members safe, that saved lives, I truly believe. Over the course of the pandemic, I issued executive orders to govern how the community addressed this pandemic. And these executive orders covered a public health state of emergency in the community, first and foremost. A stay-at-home order that has been in place for most of the past 8 months, requiring members to remain in their place of residence unless conducting essential activities. An ongoing prohibition of gatherings more than 10 people. A mask mandate everywhere on the reservation. In fact, we were one of the first jurisdictions, tribal reservations, nations, jurisdictions in general in the state of Arizona. The state of Arizona still does not have a mask mandate, sadly. But we were the first ones to issue, through my executive order, issued a mask mandate everywhere on the community. Closure of all schools on our community, including our Federal Bureau of Indian Education schools, our parochial schools, we have 2 of those, charter schools and state schools. Closed for in-person instruction, where we're doing virtual instruction now throughout our community schools. Additionally, ensuring that any high-risk employees had extended leave to make sure those with underlying conditions weren't vulnerable to transmission of the virus and had a safe working alternative. Testing for all employees of the community every 2 weeks, self-quarantine requirements, and enforcement measures if needed, and a moratorium on any new evictions initiated by our community housing department. And because we're a self-governed tribe, we're fortunate, and this is the foresight of past leaders. We have our own telecommunications company. We have our own utility authority, Gila River Telecommunications, Gila River Indian Community Utility Authority, respectively, and also a moratorium on any utility turnoffs during this time as well. And I want to note, again, the community was one of the first jurisdiction in the state of Arizona to have a mask mandate. We know that until vaccines are available, safe vaccines are available, this is our most effective way to avoid transmission of COVID as well as social distancing. So I want to go next to our testing plan. We knew that the key to avoiding a significant outbreak in the community was to come up with a test, trace, and treat protocol for our members, patients, and employees. This was a challenge. In the beginning, the community was competing, as was other tribes, for supplies and lab access, just like every other jurisdiction. Because we run an Indian Health Service funded facility, our hospital ultimately obtained an Abbott rapid testing machine, but supplies even then were limited and couldn't keep up with the demand we knew we would have to have any hope of containing the virus. So our elected leadership decided to come up with a community-wide plan, and we reached an agreement with the Mayo Clinic to process a number of our tests in a 48-hour time frame. Now remember, during that time, especially during the really rough times during July and August, it took days, if not over a week, to get testing. So truly, we had to be very entrepreneurial and look at different patchwork agreements to patch this overall protocol together for testing, this overall system of testing together. And so that first agreement with the Mayo Clinic, we were very fortunate to be able to enter into an agreement with a world-class organization such as the Mayo, and to really be able to run a number of COVID tests within a relatively short time frame early in the pandemic. And as we entered into an agreement with Steward Healthcare Systems to conduct tests for our employees, we created a schedule to rotate testing throughout each of our 7 districts. And employees and elected officials are tested every 2 weeks. So those testing that we continue to do even now throughout our 7 districts, that's also surveillance testing that we conduct, that any community member, any resident within our community can present themselves at this rotating schedule throughout our 7 districts of our communities to be tested during our scheduling, where we have every week we rotate throughout our districts. So we have the surveillance testing that is done through our Gila River Healthcare, and then we also have with Steward Healthcare Systems, we are doing testing of all of our employees as well. So utilizing this comprehensive testing program, the community has now conducted over 127,000 tests. Our testing program, with that number of tests, makes up approximately over 5% of all the tests conducted in the entire state of Arizona. This testing protocol has helped us truly contain the virus in the community. But this is a pandemic, first and foremost. There's no way to keep the virus out totally. And I'm sad to say, as of today, that we have lost 30 community members to this horrible virus. Each of those community members were valuable to the community, and their deaths ripple throughout the community. These are losses that will stay with the community for a long, long time. Now, as of yesterday, we have a total of 1,160 members of the community who have contracted COVID. And like everyone else in the state and in the country, our numbers have spiked since the beginning of November. The largest number of cases in the community, I want to bring your attention to this, are those between the ages of 20 to 44, followed by those less than 20 years of age. Now, our elders, those 65 and over, represent the smallest number of cases. And I think that's because our elders have followed the stay-at-home orders carefully and have remained vigilant. And I thank them for their leadership, for their modeling, for doing this. Now, I just received a report from the community's tribal health department. And as I do every day. And this part of the data that we use to adjust our COVID response plan is very critical as we make decisions. And I also use this data to communicate directly with the community as well. I started with a series of video messages to my community. And also we put this in hard copies through our tribal newspaper as well. So communication has been critical during this pandemic. I knew it was important to provide consistent, transparent communication with the community, whether it was bringing hopeful news or bad news. Our people deserve to know the truth. And on the flip side, I knew that our people, from our elders down to our youth throughout our community, could handle this, the truth as well, could handle the good news with the bad news, to inform them, to educate them, because these have been unprecedented times. There have been a good deal of misinformation about this virus in the mainstream media, on social media, in our news, from prevention measures and about whether and how soon the virus would diminish. And so that made my communication to my community members that much more important. In order to ask them to make sacrifices, to stay at home, to wear their masks, to not gather, which is so foreign to our community, to Indian people. To do that, I needed to be completely honest with the community about our efforts and the status and state of affairs of the virus in our community. So the COVID-19 data report is available publicly, so every community member can see the numbers of cases and the trends. So starting in March, I also, again, as I said, I started recording video updates to the community. First, I did daily reports, and now they are weekly and more often as they are needed. In those reports, I provide a COVID update of the numbers and the trends in the community. And I inform the community of our efforts and what they need to know about staying at home, school closures, testing, and now vaccinations. We also have had town halls with our elders to make sure, virtual town halls, to make sure that they have the latest information. And our youth council is going to have a webinar this month to make sure that our youth are informed of what it will take to remain safe during the holidays. So we'll continue these communications until we have vaccinations and can return to a level of normalcy in the community, hopefully soon. Now, with vaccinations, I mentioned vaccinations. We are very hopeful that we're getting close to a time when the entire community can be vaccinated and we can all return to work, school, family gatherings, and travel. And I've also been in the contact with the Indian Health Service, the state, and the Biden transition team, all in the last week to make sure that the Gila River Indian community and other tribal communities are not left out of this vaccination plan. And as I wrap up, while it may not be intentional, if we are not in front of the decision makers, Indian country can sometimes, and we've seen that, be left out of the discussion. So I have made it a point with my council supporting me to advocate strongly for vaccinations in the community, because we need to make sure the entire reservation is accounted for in any distribution plan, and all of Indian country as well. Because, Indian country, tribal people, we've been especially hit. We've been the hardest hit by this pandemic. We have the highest number of cases pro rata in the country. I've been in constant communication with my fellow tribal leaders, and we share information about best practices, so we have the best chance of keeping our community safe. But there has been heartbreak throughout Indian country as well. Not a day goes by I don't hear stories about losses in our community and tribal communities across Arizona and across Indian country. My fellow tribal leaders in the plains right now are facing an especially dark time. This pandemic has highlighted the struggles that we have faced for a very long time. And unfortunately, the underlying health conditions faced by tribal people are those that are exacerbated by this virus. At the Gila River Indian community, we have the highest rates of diabetes in the country. And so that historic lack of investment by the United States in our infrastructure has made the virus worse, and also has made solutions incredibly challenging. Maria.
Thank you. Thank you so much, Governor Lewis. What you're describing is almost like trying to rebuild a ship while you're going along on the ocean, with having to just jump in and develop a plan, trying to save lives, prevent the spread, but still trying to move forward and messaging to your communities. And we're getting a lot of responses in our Q&A box where people are thanking you as a leader and thanking you for taking such swift action to address and respond. I don't know that you signed up for this when you became a tribal leader. I don't know that any of our tribal leaders signed up for this. And I see people are questioning and asking what ITCA has done lately. Well, I have to tell you, ITCA's programs and services already are in alignment with what needs to be done during a pandemic. And so through our 68 staff and our 45 multi-million-dollar federal grants and contracts, we were able to increase the efforts of sending out PPE and equipment and food and everything out to tribes, and working very closely in partnership with our tribal leaders. So I'll take some time to respond to more of the questions on the Q&A box, but right now we do have a couple of questions for you, Governor, if you have a few minutes. These were submitted by tribal leaders a little earlier, and some from community members and some from health workers too. So do you have time, Governor, for a question or two?
I do, definitely, yes. This is well worth the time here, Maria. Yes, to share whatever I can, yes.
Thank you so much. So the question is, after having gone through such a serious public health threat, we see the need for more American Indian students to enter science fields and STEM careers. Do you agree with that? And if so, what are some of the ways Gila River is introducing students from your community to STEM careers?
You know what, that's a great question, and I definitely agree. In fact, when I tell my youth, because we are the people of the river, and we were, we proudly trace our lineage to the Hugam civilization that, of course, modern day Phoenix sits on. All of those modern canal systems, those are built on the original thousands of years ago that were built and engineering marvel from those, from the Hugam civilization that brought water. So the hydrology and the engineering technology, that's science, and that's in our DNA. And I tell our community member, our young people, never betray your DNA, your bloodline. You have science in your bloodline. And so we've really definitely, with myself, my brother John Lewis, who's who's in leadership and currently now with Gila River Telecommunications, working with our tribal education department, really working with our teachers, our teachers and in our schools and in the leadership. We've really come together and made a very concerted effort to introduce STEM, robotics, to introduce these type of coding opportunities for our community members. And so I think for tribes, looking at those partnerships as well really helps. In our northern boundary, you have one of the largest manufacturing technology plants in the world, Intel. And so we have a great relationship that we're growing with them. And so I urge, because you look at Arizona, you look at a lot of heavy tech companies that are located here. This is something that both tribal leaders and ITCA can help to leverage to open up those communications with the Apples, with all of these tech giants that are located in the Silicon Desert, right? Biotech, that runs the gamut. And so what we're trying to do, and as a tribal leader, Maria, since we have an incoming vice president who was the vice president for President Obama, when I was a lieutenant governor, Intel was just opening up one of the largest, one of their largest manufacturing divisions. Then President Obama came. Oh. And I had the opportunity to meet with him as lieutenant governor. And of course, Intel was maybe just less than a mile from our reservation. And I explained that to him. And President Obama said, Lieutenant Governor, you know what? If you want your children to even have a chance at working in a place like Intel, we don't want them to be mopping the floors, but actually being engineers. You as a tribal leader are going to have to take the leadership to make sure that they're being taught the latest and greatest to provide them with a world-class education, exposing them to science, technology, engineering, and math. Have them put down the video games. But now we're seeing that video games are actually a very good gateway to introducing them to technology. But at the time, he was very adamant about that. Have them put down the PlayStation, and have them start to look at exactly, what it takes to actually code these programs and to provide them, access to those type of opportunities. What we have, and what my brother was really championing too, is STEAM, science, technology, engineering, arts, agriculture, architecture, and math as well. So tribes, we can take STEM, we can use that and draw parallels to our own value systems, to our own history, as a way to mobilize and to get our young people excited in STEM. And so those are just a few of the examples that we're using to incorporate STEM at the earliest ages to our young people on the Gila River Indian community.
That's so exciting. Here at ITCA, and you've been here with other tribal leaders many times, and we're really, our work.
It's been a while. I'm going to come back.
I know you want Ernie's, right? The chili. But, here, so many of our jobs, just like with Gila River and all of our tribes in Arizona, a lot of our future jobs and our development of our workforce really will hinder around that science background. And so I think this is like a touch point for all of us to just go ahead. We know we're good at math. I don't let anybody around me say, I'm not good at math. I'm not good at math. Just don't even say it out loud, because right. We know we're good at math. Look, like you said, look at the Hohokam and what they developed and how we're all living here in Arizona because of your ancestors and all of the ancestors here in Arizona.
And Maria too, I think healthcare and public health, I think this pandemic showed that we need to put a very strong investment in that as well. Yes. I think for the Gila River Indian community, we came up with an agreement with the University of Arizona to provide contact tracing support to our tribal health, and also, looking at ways where they can help our own tribal health department work on modeling and using that data to analyze the COVID statistics, so people like me as a tribal leader can make those informed decisions based on science. So we run our own healthcare system too, and we have to look at ways where we need to provide those pathways to the healthcare profession. We need an unprecedented push now coming out of this pandemic. Indian country, if not the nation, is going to be looking at this, but Indian country can take the lead, right? Tribes can take the lead in really creating pathways and creating incentives and mobilization to our young people to go into these healthcare professions that we're going to need. We're not going to, once we go through this pandemic, we're going to come out, we're resilient, but at the same time, there's going to be more challenges, more healthcare challenges, in addition to the existing healthcare challenges, such as diabetes, heart disease, et cetera. And so we're going to need, this could be a historic time, for us to address just those issues, Maria.
Absolutely. And Governor, I just appreciate your comments, your thoughts as always. Yes, you're my boss, but I really admire the work that you do and your leadership. And we've kind of run out of time. And so we have our next presenter, but I just want to thank you for all the ways you serve as a tribal leader. It's very, very meaningful whenever we have you join us. And so thank you so much for taking the time to join us today.
Well, thank you, Maria. Thank you, everyone out there. Everyone stay safe. Again, wear your mask. Mosapa.
Bye-bye.